Hi, this is Jennifer from Massage Magazine here at the FSMTA 2013 convention in Orlando, Florida. And right now I am joined by Don McCann of Structural Energetic Therapy. How are you today?
Very good.
Great. Now tell us a little bit about structural energetic therapy.
Well, structural energetic therapy is a rehabilitative therapy. It's based on bringing people out of a condition called the core distortion that we're all born in. And it's responsible for about 95% of musculoskeletal pain. And standing people up and seeing them standing up is the way you see the core distortion. You can see a spiral and a twist that goes all the way down their bodies. And we found that as we observe people in pain, we see components of this core distortion that are more collapsed than others, and usually directly related to the pain, to the point that about 95% of musculoskeletal pain is related to it. So a lot of our clients initially came to us in pain, and we're doing soft tissue myofascial work. We could get them so far and couldn't get them further. So we added a cranial component, which is cranial structural work, that literally will go ahead and unwind the cranium and bring the pelvis into weight-bearing support, the sacrum and the ilium, which is a major part of the collapse of the core distortion. So we have integrated the cranial structural along with the specialized myofascial techniques, and then along with specialized energetic techniques, because we look at the whole way the body has to heal, and trapped emotions and energy flows have to be reestablished. So we look to have a full rehabilitation, and we're looking at its long-term when we address it from the standpoint of building a structure by bringing the core distortion back into weight-bearing support.
Okay, great. Now, when clients, they present with various symptoms, so what is structural energetic therapy? What kind of symptoms would it be best for?
Well, considering that 95% of musculoskeletal pain is due to collapses in the core distortion, we're going all the way from headaches, disc issues, scoliosis, which everybody has a degree when they're in the core distortion because of sacrum tips, to knee and hip and foot injuries, things like plantar fasciitis, to sprains and strain recovery, to even things like acid reflux and hiatal hernias, because the torsion in the thoracic area causes the diaphragm to put uneven pressures on the esophageal hiatus that closes the stomach. So we're really looking at incredible things, balances all the way up musculoskeletally. Also, when the body's in the core distortion, the bone-muscle relationship doesn't work right. So approximately 50% of the muscles are weakened in what we call strain patterns. And we can bring those back into full support. This unlocks huge potential for athletes or for performance in people. Also for longevity, because when your body starts to deteriorate in the core distortion, you get things like chiropractors have diagnosed degenerative disc disease. That's a basic function of being in the core distortion. Well, your life isn't good and it doesn't last as long when you're in degenerative disease issues. Bringing the body into structural support and balance takes it out. But even things as severe as stenosis with bulging disc, as we bring the body into balance, we take the pressure off the disc so they quit bulging as much, and the more alignment we have, the less impact the stenosis has. So we can get people from severe situations like that with both legs going numb and not being able to walk, to as simple as tension headaches. TMJ, the imbalance of the cranium, is directly related to TMJ dysfunction. So much of the TMJ therapy has been focusing just on the soft tissue and not on the alignment or the motion of the cranial bones. One of our first tests is to check that and then eliminate that from the very beginning. Seeing many things as part of the core distortion versus a symptom by themselves, and building a structure to rehabilitate the whole structure that takes away the symptom.
Great. Now tell us a little bit more about how one would receive training.
Okay, we have two trainings for structural energetic therapy. One is a weekend training for a year. You meet one time a month. You practice in between and come back with the skills you developed and the strength you developed and the experience you developed, and it's building the skill sets, one skill on top of another. We start off with the cranial structural work because we can create that initial structural balance that we can rehabilitate to. Then we run into the myofascial techniques, the specialized myofascial protocols, and we start off with the head, neck, and shoulders. Probably the most common treatment we do for headaches and all the neck problems and tension issues people have up there. But then we run into the other soft tissues that bring the pelvis into balance, which goes all the way to the feet and the legs. And then we take a look at the part that affects the spine more, the thoracic area, and go from the pelvis to the shoulders. After the core distortion is in a very good support issue, there's still issues of people have had additional injuries and different things that we call sub-patterns. And we have another whole set of cranial work for every sub-pattern. There's a cranial distortion that can be corrected, and then there's a soft tissue protocol that can be applied. Now, I mentioned the energetic aspect. We have several energetic trainings within this part of it. One is what we call the quick release, which opens up the energy flows to the head, neck, and shoulder, and also throughout the body, and also allows people that can't lie comfortably on a table or have a lot of pain to start easing that pain right away. That's using acupressure, trigger points, and a modified AO release, which is Atlas occipital release. Then we run into the emotional release. People don't heal if they keep the emotion in. There's a lot of emotional release that comes out just naturally from releasing the tissues. People get lightheaded, people actually have cry or laugh or giggle or whatever. Or sometimes it's impactful as a primal scream to release an early trauma. Then we come into, sometimes this is really stuck and it's at a very early core level, so we use specialized breathing techniques to get to that. So we have a whole weekend, one whole weekend is on emotional release techniques, so we can work with the whole body. Okay, so that's a pretty good example. It takes a minimum of the 12 weekends we have, or it can be done on 6 4-days sessions that are done during the week. So if people had to travel in from out of state, they could cut down the number of trips and airplane tickets by half by doing that. Or a lot of massage therapists are busier on the weekend, so it's easier to be there during the week. So we are set up to work people's needs both directions that way. The other thing that we really believe in, we have small classes. We have individual table instruction. Anytime you're working on someone, there's an instructor for every 2 or 3 tables that are being worked on. So we don't leave anything to chance. We want our people that take our course to be able to be out there successfully practicing with the techniques that we believe in so much.
That's great. Now, where can our readers go for more information about structural energetic therapy?
Well, we have a great website that has approximately 90 articles that have been published about different treatments involving structural energetic therapy. It has the explanation of it. Has information about training. Even if you just want to learn the core distortion release, that'll make any other body work more effective. And it also has Find a Practitioner. So all that is there, along with client testimonials and student testimonials of what they found changed in their practices and why they took it and what they're doing differently that really makes a difference in their lives and their practice.
Well, thank you so much for talking with me today.
Well, thank you for talking with me too. This right here is our booth that we are here at the convention, and we're doing cranial structural core distortion releases on people, because we can bring so many massage therapists more into balance very quickly. It's the single most important thing we can do for people to get a long-term structural balance for them. So we have a lot of our volunteers that have been trained here just having a blast working on people.
That's great. Well, thank you so much.
Thank you. Have a nice day now.